So good morning, everybody. My name is Clare Relton. I'm a Senior Lecturer in Clinical Trials at Queen Mary University of London. I'm also an Honorary Senior Research Fellow in Public Health, and I'm here with my lovely colleague, Megan Blake. We're going to be talking to you about Fresh Street, so welcome. Thank you very much, everybody, for coming. We're going to be recording this meeting, so just to bear in mind in terms of your sharing. We've got a whole hour. The plan is that we're going to be doing a bit of background, talking about the project that we've got funded, talking about the development and testing of the idea that happened before the project, and then exploring how we're going to be, our plans for assessing the impact of this approach at scale, the challenges and opportunities for this, and then we're hoping we're going to allow a good amount of time for questions. So can everybody hear me? If there's any problems, just put something in the chat, and hopefully either Megan and I will be able to find it. So everybody turn off their videos at the moment, please. I think there's still a few people with videos on. Okay, so great, let's get started. As you all know, there's growing food insecurity in the UK, and here in the UK we have diets which are predominantly high energy dense, nutrient poor, and processed foods, and generally they're very low in fresh fruit and veg. And we also know that how we eat and produce and consume food is a challenge to our environment. And as we know, how we eat and what we eat and the way we eat impacts huge amounts, a wide range of different aspects of our lives. So we also know that the current sort of safety net with regards to nutrition is Healthy Start, the Department of Health funded scheme, which offers vouchers worth £3.25. I think it's £3.40 now to mothers who are pregnant or with children up to the age of 4. We know that this scheme, which has been around for about a decade or so, is actually declining in popularity for a whole host of reasons. One of them being the fact that there's quite often a stigma associated with the vouchers. We can talk more about that later if people want. So last July, there was a call from the National Institute for Health Research, Public Health Research Board saying, hey, we're wanting to fund some research into systems approaches to local influences on food choices and diet. And they had a whole page of specification with regards to the questions. The main questions that we were really attracted to and really were keen to have a go at answering are, what are the impacts, including on inequalities in diet and health, of local campaigns encouraging healthy food choices through marketing or other means? And what are the impacts of structural or policy interventions that aim to increase the availability of healthier foods at a local level? So we thought, okay, so we've just heard about 3 months ago that we're going to be funded to assess something called Fresh Street, so which we're really excited about. So we haven't signed the letter with the Department of Health yet, but that should be happening in the coming weeks, and we're hoping to start the whole project in the next month or so. So this is a sort of an appetizer with regards to our project. So what the NIHR are funding us to assess is an intervention called Fresh Street. And here are the key components of Fresh Street, which is basically it's a weekly delivered voucher scheme which delivers 5 £1 vouchers. These are redeemable with local independent fresh fruit and veg suppliers. They're offered to households, not individuals. All households are eligible, regardless of the size of the household, the type of household, or the income of the household. And households are actually encouraged to share the vouchers. Included with the vouchers are easy veg-based recipes each week, a brief recipe-related piece of nutritional information, just a couple of sentences, healthy eating messages in line with current guidelines like the Eat Well plate, etc. And also information on anything that's relevant with regards to services, assets, initiatives in the local area or nationally that actually sort of work well with food and health. So this was a scheme that we developed with some funding from the MRC a couple of years ago, and we developed and feasibility tested it. So I'm going to talk to you now about how we developed the idea and what are the initial results of our feasibility test. So this is the work we did prior to the new project that I'm talking about now. So we had funding from the MRC, and then we worked with Barnsley Council and also Alexander Rose Charity to develop this idea. So vouchers for fresh fruit and veg. Our questions 2 years ago were, can we develop an area-based scheme? We knew it was a novel approach, but we thought, well, let's have a go. And what would it look like? What would be the value, the vouchers, the timing, the type of voucher, how would they be delivered? Could we deliver it? Could we reach the population we really wanted to reach? And how would we measure the impact? And how might it work with everything else? So what would it be impacted on or impacted by? So we conducted a community consultation to try and answer those questions. And the result of this community consultation was actually, yeah, we can actually develop an area-based intervention, and we're going to target streets rather than people. So, and it was households. We thought, okay, the unit which would be receiving the support would be households, not individuals. So unlike Healthy Start, which targets individuals who are on low incomes, this is a household approach. And it's all households, not just those on benefit. As I said, 5 £1 vouchers every week. And these vouchers are only redeemable at local fruit and veg shops and market stalls. They can't be redeemed at the supermarkets. And again, weekly recipes, healthy eating messages, nutritional information. So that's what we developed and feasibility tested. And we also knew that we needed an efficient voucher redemption system. One of the issues, I think, with Healthy Start is sometimes it takes up to 6 months for the person, for the shop that gets the vouchers to actually be reimbursed for the amount, which adds to the stigma associated with the Healthy Start scheme sometimes. So we identified a great voucher redemption scheme that was really efficient, called Rose Vouchers. So that's being run by the Alexander Rose Charity, and we signed up some local suppliers. So that's the daughter of the shopkeeper at Lath's Lane 5-a-day shop, which was the local fruit and veg shop, and then on the right hand side, that's one of the 6 Barnsley Market fruit and veg stores. We went to the local community and said, okay, where do we test this? And they randomly selected 4 streets out of a hat. We've got the oldest person, the youngest person at the community shop to do that. And these were the 4 streets that were randomly selected by the community to test this idea out. So we went around every household, we delivered these posters, and when the scheme started, people got these bright green envelope with their household number on, and inside there were the vouchers and also this key message, which we repeated every week. So the more fruit and veg we eat, especially veg, the healthier we are and the longer we live. 5 portions of fresh fruit and veg a day is good, 7 is even better. So that's some recent research that we found. So we started off with 4 streets with 99 houses, 97 of which were occupied. We door knocked, we leafleted with information. And we also asked people if they could fill in the health questionnaire so we could get some idea of the impact of the scheme. We used a well-known local health questionnaire called the Yorkshire Health Study Health Questionnaire, which had been developed in Yorkshire. It's a project that we led up at the University of Sheffield. We've got over 77,000 people in Yorkshire who filled it in. And we said, you know, if you want to take part in the scheme, would you fill in this health questionnaire? But what we did find actually, that asking people to fill in the health questionnaire was a barrier, in that 9 out of 10, well, lots of people said yes when we gave them the questionnaire. They said yes, they'd fill it in, but they didn't. And then talking to people, it turns out that it was a barrier, because one of the reasons being that it asked questions about people's health and mobility, that was something that if people were worried that actually that data may actually come back and negatively impact any claims that they made with regards to income support in the future. So we thought, well, we don't want our evaluation methods to be a barrier to what we're actually testing. So we stopped asking people to fill in the Yorkshire Health Study, and instead we just talked to people and asked them questions at the doorstep. So once we removed the condition of people having to fill in the Yorkshire Health Study Health Questionnaire, people changed their minds and started joining up very fast. And by week 8, almost everybody had joined. And people were reporting really positive, we're being very, very positive about it. We had enough vouchers initially for 6 months from Barnsley Council and Alexander Rose, but because it was so popular, and there was really good coverage in the local Barnsley Chronicle, Barnsley North Area Council allocated some of its precious funding to help us extend the scheme. So we actually tested the scheme, feasibility tested it for a whole year, and in total 80 households joined. And these households included adults and children. A lot of them were two-person households, and then the rest were households with children under 18. Over the year, we issued about 20,000 vouchers, and roughly 90% of these were redeemed, and 2/3 of them with the local shop and 1/3 with the market stalls, the fruit and veg market stalls. We talked to people many weeks when we went round into the community, and people talked about eating and spending more on fruit and veg. Never had as much. People talked about trying more varieties with regards to fruit and veg. People being open to new things. One of the key questions was our voucher scheme subsidising people's existing fruit and veg spending, or was it actually increasing their capability? And there was a whole variation. So some people, it wasn't increasing the amount that they were spending, but the vast majority of people were saying it was partially subsidising or actually even completely increasing the amount that they were spending on it. We haven't got any hard facts because we didn't have a rigorous method of evaluation because we were just feasibility testing. But most people said, well, I'm saving more and I'm eating a bit more veg. People talked about a lot about the fact that the repeated nature of the vouchers coming through every week helped them think about fruit and veg, prompted them to buy fruit and veg, and helped them buy fruit and veg. Because it's free, they get veg, and because the veg is there, they eat more. So these are all quotes from what's called a rapid ethnographic assessment. So basically field notes from our researchers who went around and talked to people. Yeah, so the nudging aspect of repeated vouchers was really interesting. People felt like they had to spend them. Once they got the vouchers, they thought, well, I don't want to waste them. I'll go and buy some fresh fruit and veg. And because it was there, then they went, oh, well, I'll eat it or share it. People very often talked unprompted about health. So when we said, how's the scheme? They then started talking about their health conditions themselves or their family, and also health-related behaviours. So some talked about saying, well, actually, I'm now dieting. I'm now joining the slimming world. I'm feeling healthier. I've got more energy. I'm losing weight. So it's very interesting. People almost automatically started talking about their health when we started talking about the vouchers. Many reported actually new purchasing patterns, so shopping at the local shops and the fruit and veg stalls at Barnsley Market instead of the supermarkets. Some people actually started talking about going to the supermarkets less or even stopping. They talked a lot about the different quality of the fruit and veg, and because they were also going to the markets, they actually prompted them to buy other things at the vouchers, other things at the markets. We had recipes each week along with the vouchers, which were surprisingly popular. Or they didn't like my nettle soup. So we encourage people to share the vouchers because we thought, well, some households are just going to have one person in, and some households are going to have maybe 4, 5, 6 people in. So rather than try and accommodate that variety within the scheme, actually just allow people to share the vouchers as they see fit. And a lot of people did report sharing vouchers with other members of their family. It tended to be people in their family or extended family systems that they shared them with. Although some didn't share, some said, actually, no, we need all these. One other thing we were really interested in was what the impact was of the vouchers on social interactions and social isolation. People talked about using the vouchers and and cooking for her son, making him more aware of the importance of fruit and veg. Some people swapped vouchers and said, here's £2 worth of vouchers, that person would buy more. And then cook and then give the food that they're cooked with the vouchers back to the other family. People started taking other people shopping in order to go to the greengrocers. So there appear to be signs of increased interaction and possibly some ways of reducing social isolation. So sadly, at the end of the scheme was very popular. I think only two families dropped out, and it was all because they left the area. So everybody who actually joined the scheme stayed. So at the end of the year, we had to tell people that the voucher system was going to stop, as we hadn't got any more funding for the vouchers, and it was the end of our study. So we said, we gave people due warning and said, what are you going to do when the vouchers stop? And interestingly, many said they would continue. I'll carry on buying the same amount of veg. I've got used to getting the vouchers and have got into a routine of going to get veg. I'm never going to go back. I want to carry on this healthy lifestyle and not put weight on. But others said that they'd have to cut back. They wouldn't be able to buy as much fresh veg. They'd have to use more frozen and only allow the kids to have the fruit and not the adults. That's something people said quite a lot, that they just bought fruit for the kids, not for themselves. And others talked about having to reduce the amount that they buy. So while we were doing this research, we were also talking with Barnsley Council. We were also talking to Sheffield City Council, which was very concerned about the food deserts that they have, that are there in many parts of the UK. So we, after discussions with them, they chose an area called Gleadless Valley, which is a food desert. And we targeted one of these blocks of flats, Callow Place in Gleadless Valley. So Gleadless Valley, so this is these blocks of flats are about 3 miles away from the city centre and the fruit and veg stalls, and there is a small, very, very small supermarket, sort of like a mini market, that has got about half a shelf of very old fruit and veg, not something you want to buy. So they really don't have access to any good quality fruit and veg within 3 miles of that area, so it's technically a food desert. So we worked with Regather, a local food cooperative that works in Sheffield in terms of helping people grow food and distribute good quality local fruit and veg. And we also actually developed our own voucher scheme this time, rather than working with Alexandra Rose with the Rose vouchers, as they were too busy doing other things. So we adapted the scheme so that rather than the vouchers being exchangeable at the local shop and the fruit and veg stalls at Barnsley Market in Sheffield, they were exchangeable at the market stalls in Sheffield Market at the moor, at the bottom of the moor. But also they're exchangeable for a veg bag. So this is a £5 veg bag that was created by Regather and then distributed every Friday. And they would take it to the community room at the bottom of the block of flats, and then people would come and collect them. So although there was enthusiasm, people liked the quality of the food, that it really didn't take off. I think probably only about 10% of people tried, 20% of people tried it roughly, but then uptake gradually declined. And the key thing seemed to be that people wanted to choose their own fruit and veg. They didn't like having things, giving their vouchers to something and then opening the bag and finding things that they didn't like or they didn't like. So that was interesting. So that was just our small feasibility study in a food desert of this area-based approach. So now I'm just going to hand over to Megan. So if Megan takes off her microphone.
Hi, thank you very much. That's great, Claire. So I just wanted to pick up, so we've been talking about health issues, but I wanted to pick up on some of the other elements to this project that make it more of a systems kind of approach. One of the things that we really were trying to do, or really are trying to do, is kind of create an opportunity, a very locally based opportunity to improve people's access to and demand for fruits and vegetables. So traditional food desert interventions focus on supply and typically give tax incentives to multinational vendors, large supermarkets. It doesn't do anything to create the other side of the market to increase demand for the fruits and vegetables. Because of low profitability on fruits and veg, mostly to do with shelf life, so fruits and veg go off. Without demand support, these fruits and vegetables tend to disappear from the shelves, even after the large supermarket goes in and promises to provide it. What's different about our project and different about Fresh Street is that we create local demand for produce by increasing the capacity of consumers to purchase fruits and veg. So it's very much a demand driven. We create the market for fruits and vegetables. We created, and we do it for local vendors. So it's a bit like the Preston model, in that the idea is that we keep the money that goes toward buying the fruits and veg within a local area to be reinvested in terms of employment, to build up the capacity of vendors to be able to serve their communities, to increase the variety of fruits and vegetables and so forth within a space. Because the project lasts for quite a long time, and because it's area-based, it's not this sort of spotty kind of notion that you get with the Healthy Start vouchers. You actually get a locally based, consistent, and stable market. Somebody told me once it takes about 6 months for a new product to become acceptable in a place. And of course, with fruits and vegetables, that creates waste while people are learning to accept it. And it's a non-profitable thing. But actually, by creating this demand for fruits and vegetables, then what happens is that you kind of you make it much more stable, and less, the market traders and the vendors are less vulnerable to the cost of that waste. Certainly people in Sheffield described going to the market to get fruits and vegetables, and then what they also did is they went and visited other market traders and actually discovered the Sheffield city market in a way that they hadn't previously. The other kind of element to this, and it's an important one, is that the area-based approach, because there are not barriers to accessing the vouchers, it reduced stigma. People sort of mention, I realize I'm getting these because I live in a low-income area, but everybody people experience stigma where they live and amongst their peers, and because everybody was getting them, they didn't feel like they were being picked out as the poor people on the street. And then finally, the other thing we found, and which Claire mentioned a little bit earlier, is it certainly was building community networks with neighbors, but also building networks with various vendors. So people would go back to the same vendors, they have conversations, that sort of care and resilience that's important for supporting and checking in on each other began to build up as a result of the project. All right, I'm going to pass back over to you, Claire.
Brilliant. Thank you, Megan. So coming back to the present and where we are now today, so we're just in final negotiations with the NIHR to conduct what's called a cluster randomized controlled trial. So we're going to be randomly allocating areas and comparing what happens in the areas where we offer this place-based household level subsidy for fresh fruit and veg to areas where we don't offer this place-based household level subsidy for fresh fruit and veg. And we can be exploring the impact on diet, health and the wider environment. We've got just created the first page of a new website, so freshstreet.uk, if you want to go and have a look there. This is the team. It's led from myself at Queen Mary, with quite a lot of academics at Queen Mary, but we're also working with the lovely Megan in Sheffield, Jean Adams in Cambridge, and Rupert Suckling in Doncaster, who's the Director of Public Health there. So that's the academic team. And then we've also partnering with Jonathan Pauling and Faith Holland at Alexander Rose Charity to help us with the reimbursement scheme, but also they've got a lot of experience in this area. And Kevin Williamson, who's leading the team at Doncaster, and Esther Hall, who's leading the team in East Riding. So what we're hoping to do, so we've got the funding we've got is for a 3.5-year study, and in this study we want to generate evidence on a broad range of interconnected challenges for UK public health nutrition. So diet quality, how much we, the consumption of fruit and veg, but also red meat as well, food insecurity, impact of different interventions on health-related behaviours, life satisfaction, health service use, looking at the impact on the broader social and physical environment, looking at the resources it takes, the costs of delivering things, looking at the impact on each household total fruit and veg costs, what happens to household expenditure, looking at anything unintended, And then also refining our logic model, our understanding of how this approach, the Fresh Street approach, this area, place-based household level subsidy for fresh fruit and veg, how that impacts, how that works on all the different areas we think it might work. And then we're also interested in synergies. What other things could it actually help improve? By putting in, say, stop smoking information in weekly with the Healthy Start, with the Fresh Street envelope, putting in additional information to help people support their health and the local environment, could that sort of help other schemes? So putting in things like about incredible edible or seed growing schemes or whatever. So anything that's related to food and health. So we know there's quite a few challenges for our scheme, and we can just briefly run through them now. The first one is actually funding the vouchers. So the current we currently need about £300,000 to add to our £100,000 worth of vouchers that we've got to deliver it in the 2 areas that we're initially planning to test the scheme. So that's going to be a challenge, but we've got we're very confident we're going to be able to find it, as we're very determined. Another challenge is the scale at which we deliver this. We know in terms of what we're wanting to generate, in terms of the evidence, we want to generate evidence that's going to be really useful for policymakers, people who make decisions about what interventions should be introduced in order to improve the food system and food insecurity and food systems. So we don't know, the larger the scale we will do this at, the easier it will be to see the impact in the real world, and therefore the more valuable the evidence would be for policymakers. So we're quite interested in scaling it up from where we're at. So there's opportunities for other areas to come in. And then the third one is evaluation. So how do we collect information, collecting the information we need? So we've got a broad raft of methods for evaluating, for getting information on the value and the impact of of delivering this scheme. We're sort of very aware of all that we've learnt around recruitment and retention for trials, and also very aware of our experiences when we were doing the feasibility work in Barnsley, and the negative response from people to filling in a formal formal survey or formal questionnaire where they would have to give personal identifiable data, and that data then may be shared with organisations at a later time that would be to their detriment. So we've been scratching our heads quite a lot about this, and I work in the whole area of, I'm a senior lecturer in clinical trials. So this approach about how do you evaluate things is a topic of keen interest to myself and my colleagues. So one of the things we're doing, is we're developing something called the UK National Health. So this is a very ambitious scheme to collect information from the public using a variety of short, direct, simple surveys. So one of the surveys we're going to be using for Fresh Street is going to be asking people about their diet quality. So it's going to be a simple survey, and people will be asked to give as little or as much personal information as they want. So if they don't want to give any personal information at all, that is fine. We still want people to fill in the survey and give us information on their diet quality, and that'll help us evaluate the Fresh Street. But if people want to give us more, they can. And that's also flexible in terms of what people are asked to consent to. People could say, I only want to fill it in once, or people say, yes, I'm happy to consent to further studies to give you more information. My data to be used in this way, my data to be used in that way. So it's quite a radical approach, but there's a lot of interest in using this approach to help evaluate Fresh Street, but also other interventions. So moving on to opportunities, we feel like the next 3.5 years is a really fantastic opportunity for us to explore ways for transitioning to healthier and fairer food systems, and supporting local community assets and strengthening community resilience, and also for evaluating ways of doing this. So There may be other studies that are studying other approaches to health, the environment, food, diet, etc., who might actually want to use the UK National Health Study. So there's an evaluation opportunity there. So it's past, so I wanted to give lots of time for questions. So